Okay, so to finish up our chapter on the forearm, wrist, hand, and fingers, I'm going to talk about some exercises. A little bit of this, again, overlaps with the stuff we do at the elbow and forearm. However, there's definitely some different stuff for the hand. Okay, so always important when we're doing any injury, especially an upper body injury, um, to do our best to have general body conditioning, right? So especially with a finger or a hand or a wrist, we can potentially still have the athlete running and doing sport specific conditioning. I mean, even if they're in a cast, they could potentially be, doing running on a basketball court, jumping for volleyball. Soccer players can definitely be running outside and conditioning. Um, so making sure that that athlete is still doing everything that they can. Obviously, if a doctor has said that they shouldn't do, impact conditioning like running or jumping, we can always put them on a bike or an elliptical or something like that. Okay. Um, Joint mobilizations are always a good option for wrist, hand, fingers, especially hands and fingers. Joint mobilizations can be very helpful. Um, with the carpal bones, as we noticed in the previous lecture, there's a ton of joints in there in between all those different carpal bones, since you have 8 of them, and especially in between those 8 bones and the radius and the ulna, and those 8 bones and all the 5 metacarpals. So there's just a lot of joints. So there's a lot that can be mobilized just by using your hands and using those joint mobs. So there's a couple specific techniques, and we'll look at those here in a second. So yeah, if you're working on like a specific range of motion, you might be able to mobilize the hand and wrist in a certain way. So this is kind of showing some hand placements and the movements that go along with them. The S in all of these stands for the stabilizing hand, so that hand is just holding the bones in place, and then the G stands for the glide that you're giving it. Okay, so for example, in this first picture here in A, um, the hand on top here is stabilizing. It's stabilizing the ulna and the lateral carpal bones, and then it's gliding the radius and those medial carpal bones. So this can help break up restriction between the radius and the ulna, and between the lateral carpal bones and the medial carpal bones. Okay, and then moving on to this picture B, uh, the hand here is stabilizing the radius and the ulna, and it's gliding all the different carpal bones. So it's mobilizing that radiocarpal joint and that ulnar carpal joint. Okay, here it's stabilizing again the radius and the ulna, but gliding in a different direction. Okay, so it's gliding posteriorly, so just working on different ranges of motion. You can see this is probably helping them with their wrist extension. Um, Over here, just gliding in different directions, stabilizing in different directions. And this one looks like they're even getting up into the thumb joint, that first metacarpal, second metacarpal joint. So those joint mobilizations can be helpful. Um, okay, so then thinking about the range of motion exercises that we're going to do, obviously we want full pain-free range of motion. Again, whenever I do range of motion exercises, I always say uncomfortable but not painful, right? Because when we're going from limited range of motion and trying to increase that range of motion and get more, it's going to be uncomfortable, just like anything when you're trying to push yourself to gain more. If you're trying to be able to run farther or lift more weight, it's not necessarily comfortable, but it shouldn't be painful for sure. Um, So full pain-free range of motion. So as we do these exercises, uncomfortable is good, painful is bad. We can do passive range where the clinician is taking them through all of their range of motion. We can also do active assisted where the patient is trying to actively move their hand or finger. Maybe they can't get as far as they want, and then the clinician comes in and assists and pushes it a little bit farther. Okay, same thing with strengthening exercises. We don't want to aggravate the condition that's going on. We don't want to be causing pain and inflammation. However, it still may be uncomfortable as we do that strengthening phase. And there are a variety of exercises, and honestly, you can get kind of creative with the wrist and hand and fingers just because of the nature of how they work, and I'll show you that in a minute. So here's some different ranges of motion and flexibility exercises. Okay, this is wrist flexion. All right, so as the palm is folding in towards you, that's wrist flexion. Wrist extension here in picture B. The hand bends backwards. Okay, this motion is called ulnar deviation. Okay, the ulna is on the outside of the forearm there. When the pinky moves towards that ulna, that is ulnar deviation. It's almost like a rotation. Okay, and then the opposite way, radial deviation. And you can do all these with your hand as you're watching this, but as that thumb rotates towards the radius, that's radial deviation. Okay, this is another picture of pronation and supination. So this is pronation. He's pouring that bowl of soup out. He's actually going into kind of some excessive pronation there, really trying to work that range of motion. And here's supination, opening that hand back up like you're holding that bowl of soup. And so these are some range of motion exercises you can do. This you can do on a wall, a table, a desk, something like that, where you're just passively stretching that hand. And you can do that for all of these ranges. You can also bring your own hand in or a clinician's hand and help push yourself into a little bit more. Like right here, he's doing this to himself. He's pushing himself into more pronation, pushing himself into more supination. But certainly he could do that for the wrist flexion and extension too, right? He could just take his other hand and pull that hand into flexion or extension. Okay, so those are some good exercises. There's some other stuff where you get a little more weight bearing. Something like this, you start your hands way up on the wall and you slowly slide them down, and that will push you into more and more wrist extension as you get farther down. You could do that at the edge of a table, starting your hands there, standing nice and tall, and then he can actually move and lean forward. And the more he leans forward, the more wrist extension he would get. And this is kind of a progression, right? This is going to get harder. Now, this woman is weight bearing on those hands, and you could start with your hands way out here and slowly bring them in and farther into a push-up position, pushing that wrist extension, and also using your body weight to make it really push even farther into wrist extension. Okay. So those are some range of motion exercises. Here are some strengthening exercises for the forearm and wrist. Here in A and B we have simple dumbbells. We're doing wrist curls here, wrist extensions here. Okay, so as she pulls the hand up towards her, she's doing wrist extensions and she's working those wrist extensor muscles. In this one, as he pulls the palm of his hand towards him, he's doing wrist flexion and working that wrist flexor group. Okay. Here we have, this is like there's a stick here and there's a weight hanging at the end of this rope, and he's wrapping that rope or that string around the stick by curling his wrists and pulling that weight up. The difficult part is actually to allow the weight to come back down nice and slowly. That would be an eccentric strengthening exercises, and remember that's one of the best strengthening exercises. So if he can let that weight come down slowly, he can eccentrically load. And again, with this wrist exercise, you could go both directions. You could wrap the string one direction and work your wrist flexors. You could wrap the rope the other direction and work your wrist extensors. Okay, D and E go together here. Just having the stick in your hand and then pulling your thumb up towards you. Remember that one is radial deviation. And then in this other one, pulling the pinky up towards your elbow. Remember that's ulnar deviation. So she's working on strengthening her ulnar and radial deviation in those two pictures. And then we saw this one last week in our forearm exercises, but she is pronating, bringing that weighted stick over, and then in this one she's supinating, bringing that weighted stick back. Remember, if you can go slow on the way down and really work that eccentric strengthening, you can get a lot of benefit from that. Okay, moving into the hand, some different hand exercises. This is where I was saying you can get kind of creative. This is called Theraputty, although it's very similar to like Play-Doh or a stress ball or something like that. So just squeezing that can work all of the hand muscles, all those individual finger muscles, thumb muscles, stuff like that. They probably have more like a stress bag or something in there. You could use a ball that you can squish. This one probably has sand inside of it. They make these fancy finger meshes that you can use. But all of these are just ways of strengthening. And these are all pretty much wrist flexion. Hand finger flexion, right? All of these are having the hand curl into a fist. So if you wanted to work the opposite direction, you could get creative and use a rubber band or a hair tie or something like that. And right here he's working all of his finger extension and thumb extension. And you could work the fingers in different ranges of motion. You could work the thumb separately. Okay, so that's how you can get creative using a rubber band or something else that's elastic like that. Okay, a couple slides left. Remember, neuromuscular control is really important, especially with the hand. One of the main things we worry about as they come back is different activities of daily living. So those fine motor activities of writing with a pen or pencil, picking something up off the ground, typing on a computer, tying your shoes, buttoning your buttons, stuff like that are really important. And so there's exercises you can do for those as well. This one right here is really good. Just picking something up like marbles or pennies or something off the ground or a table really works on that fine neuromuscular control, that dexterity. So that can be really good. And then as we return them to activity, we want to have something that we can measure to make sure that their strength is back. So this is a way to measure your grip strength. So you could measure and compare your right hand to your left to see if they have full grip strength back. You can obviously measure their range of motion in their different joints to make sure that they have full range of motion. And then you want to think, do they need to be protected as they go back into play? So, right here they have this wrist brace on. There's all kinds of different wrist braces, but maybe an athlete would wear one of these wrist braces or a cast or something as they go back into play to prevent further injury. Or maybe, they aren't going to come into impact on their wrist or hand and they don't need some sort of preventative mechanism. So, for example, I have football players that I use wrist braces on, and all my linemen wear some sort of wrist brace. Doesn't usually look like this unless they're coming back from some sort of major wrist injury, then maybe they would. But football linemen can for sure wear this while they're playing, and they can still do their job in blocking or rushing the passer. However, a running back or a wide receiver or something like that, they wouldn't really be able to wear this because it would impede their ability to play. So there's different factors that you got to take in, but definitely you want to think about if you're gonna have a preventative um,